Hi, we're Team 5, and I'm Natalie.
I'm Ashton.
I'm Jacorian.
And I'm Caroline, and today we're going to be talking about the impact of sleep disorders on the body. An overview of what we're going to be talking about today first is common sleep disorders and their symptoms. Then we'll be talking about the physical effects of sleep disorders, the mental effects of sleep disorders, the relationship between sleep disorders and your DNA, and how to prevent sleep disorders. Here's a short video overviewing introducing what we'll be talking about today.
Lucidchart presents.
Sleep problems can be divided into complaints that people have. One of the most common complaints is excessive daytime sleepiness. There are generally 5 major causes for excessive daytime sleepiness, the most common of which is an insufficient quantity of sleep. Many medical students suffer from this. Next is a poor quality of sleep. Environmental disturbances such as light, partner, pet, or other intrinsic sleep disorders such as sleep apnea or periodic limb movement disorder could be involved. Thirdly, and less common, is a pathologic disorder of sleepiness during the day, including narcolepsy and idiopathic hypersomnia. Fourthly, a medical or psychiatric disorder such as a thyroid condition, cancer, medication side effect, or mood disorder can present with sleepiness. Finally, a circadian rhythm disorder such as shift work or jet lag could also be a culprit. On the other hand, sometimes patients complain of difficulties initiating or maintaining sleep, or insomnia. This symptom can be a primary disorder on its own, but is usually the result of or exacerbated by one or a combination of 4 factors. 1. An acute stressor. This is a common culprit in many cases of insomnia, but often is comorbid with other factors. 2. A circadian rhythm issue, including shift work or a circadian rhythm disorder. 3. A medical or neurologic condition. Common culprits include medications or substances such as caffeine, alcohol, a thyroid problem, or other potential medical disorders. And 4. A psychiatric condition, especially mood or anxiety disorders. Lastly, another presentation could be an unusual behavior at night. This is referred to as a parasomnia or disorder of arousal. These are often classified according to what stage of sleep they emerge from. Non-REM sleep parasomnias typically include sleepwalking or night terrors, while the classic REM parasomnia is REM behavior disorder, where patients act out their dreams.
One of the common sleep disorders is narcolepsy. Narcolepsy causes you to have excessive daytime sleepiness, sleep paralysis, sudden loss of muscle tone, and it could cause you to hallucinate. Another type of sleep disorder is insomnia. Insomnia could cause you to wake up in the middle of the night too early or daytime tiredness. It can cause increased errors or accident or ongoing worries about sleep. You also have sleep apnea. Sleep apnea causes you to snore loud or wake up with a dry mouth. It could cause you to have morning headaches or gasp for air during sleep.
I'll be talking about the physical effects of sleep deprivation. Sleep deprivation is when you get less than 7 hours of sleep per night on a regular basis. The immune system replenishes itself during sleep, so it rebuilds itself. And if you're not getting enough sleep, it won't properly be rebuilding itself. So over time, it builds up and you're significantly more prone to sickness. Another thing that happens is leptin, which is an inhibitor for hunger, and ghrelin, which is an inducer for hunger, are both hormones that are regulated with sleep. Leptin is released less and ghrelin is released more whenever you're sleeping. So you'll get hungry more often. And after you eat, you won't feel full. Sleep deprivation also inhibits the release of insulin after eating, and this is linked to acquired diabetes. There are increases in blood pressure that happen with sleep deprivation also, and this increases your risk of heart attack and stroke. And hormone production in general is impeded. The mental effects of sleep deprivation. Memory issues and brain fog are very common. Mood swings and mood changes and irritability are common. Stress, difficulty concentrating, and anxiety and depression are all very common effects of having often being sleep deprived. The effects of continuous sleeplessness. So if you stay awake for 24 hours, your sleep-wake cycle is interrupted. And this means that you're going to be more irritable, more moody, and your appetite will be off. After about 36 hours, the previous symptoms become more severe, and your ability to think logically will begin to break down, and speech impairments will begin to occur. After about 48 hours, the previous symptoms again become more severe, and the immune system begins to not function correctly. So you will likely get sick or be more prone to sickness, and microsleeps begin to occur. A microsleep is when you fall asleep for less than 30 seconds. So you may have felt this in class at some point. If you just didn't get a very good night's sleep before, you fall down and pick your head back up and you're kind of disoriented. That's what that is. After about 72 hours, the previous symptoms again become more severe. And this is where the very severe symptoms begin to present themselves, like hallucinations, paranoia, anxiety, general irritation, and mental breakdown. This state can't be maintained in most people without the use of stimulants like caffeine or other drugs. And at this point, the body, without those stimulants, would just itself go to sleep. If you stay awake longer than this, there's severe consequences to it, such as muscle spasms, and that can cause you to have a heart attack or a stroke.
Sleep disorders can affect your DNA. When you have a sleep disorder, usually you have a mutation, which can either be a duplication, an insertion, or a deletion of a gene in your genome. And the location of most sleep disorders is the HLA-DQB1. That is a mutation that is common with people who have narcolepsy, which Corian talked about earlier, and cataplexy, which can be a symptom of narcolepsy. Cataplexy is when the body gets so exhausted that anytime you experience some type of heightened emotion or intense emotion, you just lose control of all your muscles. They all go limp and you fall to the ground. That's usually what the stereotype of having narcolepsy, and you just kind of collapse is. The risk of narcolepsy is 5.4 times higher in people with those who have strep, meaning that if you were diagnosed with strep in the past, like strep throat, that can change your DNA and create that mutation, or it can awaken narcolepsy, meaning that the mutation was lying dormant within your DNA and it's now active and you will have narcolepsy. Some ways that you can prevent sleep disorders, though, is that you can have a regular sleep schedule. If you get about 8 to 10 hours of sleep every night of full restful sleep, you should be fine. You can also exercise regularly by getting your heart rate up about 30 minutes a day, probably 3 to 5 times a week. And that can help you tire your body out to where you will feel that you need to sleep and you'll get a restful night because you have tired yourself out. You also need to watch your intake of caffeine because that is a stimulant. And that's kind of what Ashton was talking about earlier when he was talking about having stimulants that help you stay awake. You also need to watch your intake of alcohol and tobacco because those can also make it hard for you to sleep, or it can disrupt your sleep cycles.
So now you know all about sleep disorders, and so now you know all about the different sleep disorders, such as narcolepsy, which is daytime sleepiness, insomnia, which is when you can't sleep at night, sleep apnea, when you have trouble breathing at night, And the sleeplessness can also affect the physical and mental health. Physically, it can, your immune system will be deficient, and you have a high risk of disease. Your mental effects could involve memory issues, stress, and moodiness. Sleep disorders can also occur through mutations or genetically. And you can prevent these sleep disorders by improving your sleeping habits, increasing your exercise, and limiting your intake of caffeine, alcohol, and tobacco. These are our references. Thank you. And do you have any questions?